Now, moving on to the Hurricane Helene. President Biden and Vice President Harris continue to use every tool available to help communities devastated by Hurricane Helene. Over the weekend, President Biden ordered another 500 active duty troops to move into western North Carolina, in addition to the 1,000 troops the president previously ordered to deploy to the state. This is on top of the more than 6,100 National Guardsmen and over 7,000 federal personnel, all working together with their state and local counterparts to help people begin their road to rebuilding. Over the last few days, the administration has contacted nearly 450 state and local officials across the region to offer further support. And to date, this administration has helped thousands of Helene survivors just jumpstart their recoveries, providing over $210 million in direct financial assistance, with more coming every day. As the president has said, when it comes to this whole of government response, we are sparing no resource here. Unfortunately, scam artists and bad faith actors and others who are putting politics over people are promoting misinformation about our efforts, including falsehoods about federal assistance. This is wrong, dangerous, and must stop immediately. Elected officials at every level and on both sides of the aisle have also called for an end to these conspiracy theories. False information following a disaster can discourage people from seeking critical assistance when they need it the most. Everyone, especially those in positions of power, must do everything they can to encourage survivors to register for assistance, not discourage them by allowing these falsehoods to fester. Finally, the president was briefed yesterday and again today on the potential impacts of Hurricane Milton, which forecasts to become a Category 5 storm and make landfall Wednesday on the western coast of Florida. As with Helene, FEMA and other federal agencies are actively pre-positioning life-saving resources in advance of the storm, and earlier today the president approved Governor of Florida's request for an emergency disaster declaration, which unlocks additional federal resources to help the state respond to the storm. To everyone in the path of Milton, the time to prepare is right now. Visit ready.gov or go download the FEMA app to make a plan today. The time is right now. Please, please, please listen to local officials. It could save your life. Now, the Biden-Harris administration is committed to preventing, detecting, and responding to health emergencies globally. On September 27th, Rwanda's Ministry of Health announced an outbreak of Marburg virus disease, MVD, and the Biden-Harris administration is working closely with the government of Rwanda to end the outbreak as quickly as possible. As we have all experienced in recent years, health emergencies are a global issue we must address together. CDC assesses that the risk of the infection with this virus in the United States is low, and there are currently no confirmed MVD cases outside of Rwanda. Since learning of this outbreak, the United States has committed to making nearly $11 million available to address urgent health needs in Rwanda and surrounding countries. And although there are currently no FDA-approved vaccines or drugs against MVD, the United States also contributed investigational vaccine and therapeutic doses, which arrived in Rwanda this weekend, just 1 week after we learned of the outbreak. In addition, to keep Americans safe, we are implementing additional precautions for a small select group of travelers arriving in the United States from Rwanda, including additional health screenings. These measures will advance ongoing efforts to protect public health and reassure the traveling public that the risk of MVD spreading during air travel is minimized. And today we saw the Supreme Court decision and what it means that women in Texas could still be denied critical emergency medical care because of the state's dangerous and extreme abortion bans. We have seen and have heard the horrific stories of women being denied the care they need because of these laws. Also today in Georgia, the state Supreme Court reinstated an even more extreme abortion ban. All of these laws were made possible when the former president handicapped 3 Supreme Court justices to overturn Roe v. Wade. They are creating chaos and confusion for women and doctors. The administration has been clear that all patients, including women experiencing pregnancy loss and other pregnancy-related emergency, must be able to access the emergency medical care they need, and that is required by federal law. The stories we hear of women being denied care they need in emergency situation is completely unacceptable. That's why the Biden-Harris administration has taken a number of important steps to make it easier for women to file complaints if they are denied this essential care and investigate and enforce federal protections under EMTALA. But our fight is not over. After the Supreme Court's order earlier this year, HHS issued a letter reminding hospitals and provider associations of their obligations under EMTALA, including providing abortion care as a necessary stabilizing treatment. We will continue to make those obligations clear. We will also continue to fight Republican elected officials' extreme agenda. And we'll continue to enforce federal law, support hospitals complying with the obligations, and defend the administration's long-standing view that women have the right to access the emergency medical care that they need.